Back in December of 2006, I was involved in a very serious accident. I was on a bicycle and I got struck head on by an automobile that came across the center line and hit me. The car was doing about 45 miles per hour. I have no memory of the accident, but the EMS responded and they called for the life flight helicopter, or E-Scare, out of Vidant Hospital. And they picked me up the hospital and carried me to the hospital. And although I don't remember, I'm told that I was talking to the guys in the chopper on the way up here to the hospital. And by the time the chopper set down at Vidant, my body had just about, well, I guess I'd almost died by then. They told my wife later on that while I seemed alert on the chopper, by the time it set down, that my system had really crashed. And so I was admitted in a unconscious state, but I had both of my legs were broken, my knee was shattered, my pelvis was shattered in a bunch of places. I broke 5 ribs, broke a vertebrae in my back. I broke all the bones in my left arm and elbow and hands and fingers. My biggest issue, I think initially, was the fact that I was bleeding internally in my pelvic area very badly. And by the time my wife got to the hospital, the doctors told her that they were just going to go from minute to minute as they talked about my chances of survival. But they had a fantastic trauma team here at Vidant, and I'm told those doctors worked tirelessly for hours on end to keep me alive. They kept working and working and working, and not just the doctors, but the entire staff, the nurses, the receptionists, and everyone was so nice to my family during the ordeal. I ended up spending a month in a drug-induced coma. I don't remember any of it, but my family talks about it often, and they say that although it was a bad situation for them, the hospital made the situation better in that the doctors continuously kept them informed of everything that was going on. They were honest with my family. They told my family initially when they didn't think I was going to survive. They were honest about that. But at the same time, they worked on me all along like they were going to do everything they could to keep me alive, and they did. I ended up spending 3.5 months in the hospital, and the first month I have no memory, but after that I have great memories. I guess if you can call being in the hospital having good memories, but I just remember the treatment that I received from everyone, including doctors, nurses, the therapy department, the x-ray department. Anybody I came in contact just treated me and my family in such a nice manner. They treated us like we were, almost like we were royalty, I think. I left the hospital after 3.5 months in a wheelchair. They were doubting that I would ever walk again or ride my bike again, and I worked hard to prove them wrong, and I'm proud to say that I have proved them wrong. But I've been back in a bunch of times for follow-up surgeries, and every time I've been back in, I've received the same fantastic treatment. From the time you walk through the door until the time they discharge you, you're treated like a real human being. They listen to me and my family. They don't treat us like a number. It's always nice to have that nurse come in the room and say, "How are you feeling, Mr. Galloway?" And just those personal touches to let me know that they really care. I'd been an avid cyclist for 20 years. I was 55 years old. I had a resting heart rate of about 45 beats per minute. I was in excellent shape. My entire life I'd spent very little time in hospitals or in doctor's offices, and all of a sudden, in a minute's time, everything changed. And although I'm from the Goldsboro area, I was airlifted here to Vidant Hospital because that's where the helicopter came from, and I'm sure glad they brought me here. They didn't know me from Adam when I was admitted, but I don't think that mattered. Their mission was to save my life and keep me alive, and it didn't matter who I was, where I came from, what had happened to me. None of that really mattered. I think what mattered to the doctors was the fact that they had a patient who was on his deathbed, and they were going to do everything they could to save me, regardless of who I was or where I'd come from or anything else.